I think the patient's involvement is crucial. I'm a patient. I know from my own experience living with heart disease, diabetes, lymphedema, all these sort of things, that I'm an expert. I'm not the expert, I'm not the sole expert, but I'm an expert because I live with it. And I live with the drugs and I live with the side effects of the drugs, and I discuss that with my doctor, GP, and my specialist, and together we plan my treatment. And that way I understand better what it's all about, and that way I'm much more likely to comply with the treatment and take the tests and so forth. But there's a lot more that the patient should be doing, not only caring for themselves and their families, of course, but helping to manage an illness problem, but they can also play a part from that experience of working with people with other experiences, like the doctors and the scientists and the managers in planning services.
There are a lot of issues that I think that duly are constitutional rights and human rights. And while the patient rights are not directly on EU competencies, I think that they should be. And I'm being a strong advocate that in the longer run we should have a patient rights directive on the EU. That says, yes, you have the right to knowledge, you have the right to screening and early diagnosis, you have a right to second opinion, you have a right to medication, early treatment and rehabilitation.
I think that patients are really becoming a crucial voice in how we set our healthcare priorities. And I think it starts there, that they raise their voice whenever they see that the new healthcare policies are being devised, be it at European or at national level. So I think that today at European level we already try to incorporate in many instances the voice of patients. At national level sometimes it's a little bit more difficult, so also at European level we're trying to help and support patient organizations to also be heard at that level.
We always say that the patient's first medicine is information. So the moment we manage to give scientifically validated, easy to read, patient-friendly information to them, that's the first and most important instrument to empower patients. This also allows them to ask better and more informed questions to their physicians, to find the information they need to get their treatment better, and ultimately to have an impact, to make their, let's say, understanding, their knowledge having an impact on their outcome.
Europe is a democratic system. I mean, to have an improvement of participation of the citizens into the decision-making mechanism, or at least I'm advocating for certain things, is actually quite an important part of the process. Also because in many cases patients have to play an active role in, in treating themselves. I mean, in keeping the compliance with the treatment of the therapy, in making sure they go for screening when the screening is available. So there is a, an active role in terms of participation into the active protection of their own health, if you wish, and on the other hand, an advocacy role to make sure that certain areas which are maybe neglected, like some diseases, are not too much taken care of by the public institutions and needs to be more actively followed up. So there are these two aspects: advocacy on one side and better management of the problems and on the prevention on the other side.
Well, I can't see a good policy on cancer or for that matter, for other public health issues without working with patients and working with citizens. I think that's very, very important. And at EU level, at all stages of our work, I spoke about the development of the guidelines. We have an EU Cancer Committee, a group of experts on cancer. We have the authorization mechanisms in the European Medicines Agency. All the way through, patient representatives, patient organizations are members of the groups and are taking an important part. So I think we have developed a certain amount of good practice of involving patients and their organizations in the work. And I see that where there are successful national cancer plans, patient involvement is an important part of those plans.
Now, the key word here is communication. We always speak about information, and of course information is pivotal, but we need information to have better communication with the healthcare professionals. Patients want to be in control, and you can only be in control and empowered when you know what is happening and you can be a partner in the decision-making process. So communication is the key word here. There is a policy of transparency in most of the countries and also at the level of the European Union. But there's not full involvement of patients. As the International Alliance of Patients Organization, we presented our declaration of patient-centered care already in 2006, and one of the principles is meaningful involvement. So just involvement is not enough, meaningful involvement.